everybody. I can't believe this room is filling up. What a beautiful nightmare. Thank you for coming, and I want to let you know I'm Amy Waters. For those who don't already know me, I'm director of the Senior Center. I made it, you made it, we're here. So, we just heard from the speaker. They're almost here, so it will be worthwhile. Just be a little more patient. And I'm going to take this opportunity to thank some of the folks that are making this program possible. First of all, thank you to my staff. Suki couldn't make it in today. What would we do without her? We carry on best we can, and thank you, Shirley and Jim, Patty, everybody. And thank you so much for elder services and lunch. Can't believe everyone made it in, and there will be food. Thank you, QCC, also. And many thanks to our sponsors, Goddard Homestead, Seniors Helping Seniors, UMass Memorial Health Neurology team who are on their way, and Fallon Health. So be patient and we'll learn a lot. Thank you. So it is my pleasure, and I am so grateful to introduce our speakers from the UMass Neurology Department. I'm going to have them introduce themselves. How about a round of applause?
Good morning, everybody. Thank you so much for having us. My name is Fabiola de Varona, and
I'm Kajol.
And we will be talking a little bit about brain health, especially brain. Right. Can I just hold it? Yeah. Can you hear me now? All right. Sorry about that. So we'll be talking a little bit about brain health, and especially about how it is important with aging and what you can do to keep a healthy brain. So without further ado, so the things that we will be talking about is the difference between a normal aging brain and what's not that normal, how to care for your brain, especially throughout life and later on, and then what are some things that you specifically can do. All right, so let's start by what is brain health and why is it so important. So the brain is a vital part of our body. It should be taken care of since the time that we are born. Unfortunately, there are a lot of conditions that can impact our brain health. So what do I mean specifically when I say brain health? So it is the state of brain functioning that allows each person to reach their full potential. Our brain is important because it's the command center of our body, and it influences every aspect of our life. It is key in memory, thinking, emotions, movement, and maintaining your independence. So optimizing brain health is important because it improves your mental health, your physical health, and overall your well-being throughout our lives. It is not just about avoiding disease, but it's about living well with good quality of life. So let me talk a little bit about aging and your brain. So the aging of our brain depends on several things. First, it's our genes, and that is something we are born with. Can't really change much about it, but it does influence the risk of having issues. The second part is your environment, and that is what you are exposed to. That includes the air quality, the noise around you, the social support, the stressors around you, and even the nutrition you got as a baby. And so we have some influence over that, but not that much. The third part, and the one that we have the most power over, is our lifestyle. So this is what you do day to day. And like I said, it's the most modifiable modifiable factor. So it includes what we eat, exercise, sleep, our social connections, even being here today, that's good. The key thing is that a healthy lifestyle and healthy lifestyle choices can have a big impact in your brain health and your overall body. So let's talk about understanding the aging brain. So what is normal? Normal aging is associated with gradual changes. It can include mild shrinking of the brain, emphasis on mild, occasional word finding difficulty, maybe some slower processing, and maybe you're not as able to multitask as well as you could 30 years ago. Despite this, you should still be able to learn new things, to form new memories, and to improve your language, vocabulary skills. In contrast to that, significant memory loss, confusion, personality changes, difficulty with doing your day-to-day activities, that is not part of normal aging and should prompt medical attention. So what are some things that can affect your brain health? So it could be certain types of medicines. Maybe they make you very sleepy or groggy, or they affect how your brain functions. Smoking is a big one. Excessive use of alcohol. Several chronic diseases like heart disease, diabetes, other health problems, we'll talk a little bit more about those. Poor diet, poor sleep, lack of physical activity, minimal social activity. So being alone for most of the time is not good for your brain health either. And something that we really want to stress, hearing loss. Hearing loss can also affect your brain health. And again, we will talk a little bit about that. So what can you do to help your brain stay healthy? We'll talk about different lifestyle modifications that can help to involving our physical and emotional health, social connections, among other things. I like this little wheel that summarizes the big topics of physical health, emotional, mental health, social connections, preventive care, so taking care of our overall general health, and memory, and like I said, sensory health, that's important. So let's go a little bit deeper into each of these things. So let's start with physical health determinants. So when we talk about physical health, we are referring to healthy nutrition, good sleep, exercise, substances that we consume. So I'll go through these in more detail, and so will my friend over here. So I'll start with nutrition. What we eat directly affects our brain health. A healthy diet is important because it helps reduce inflammation. It improves blood flow to our brain. It supports our memory, our mood, our thinking skills. So diets that are rich in fruits, vegetables, whole grains, healthy fats, lean proteins are consistently linked to better cognitive health, so better memory, better thinking. Foods like extra sugar, saturated fats, those are not so good. There is strong evidence for a particular type of diet called the MIND diet. You can see it here in our presentation. So it is associated with lower risk of cognitive decline and cognitive impairment. So what is the MIND diet? So it's a combination of other diets that you might have heard around, like the DASH diet or the Mediterranean diets. What's key in all of these is what matters, what you should eat. So leafy greens almost every day of the week. Berries several times a week. Eating nuts is pretty healthy every day. Eating beans with your meals. Fish and poultry, whole grains. Using olive oil as the primary source of fat. And if you do want to use wine, no more than 1 glass a day. What you shouldn't be eating is as much, is red meats, a lot of butter and margarine, cheese. that one was a sad one for me. Fried foods and sweets and pastries. So you can see there what you can be doing to improve your health pretty much right away. Another big one for physical health. So sleep is absolutely instrumental in our cognitive function, our mental acuity, and the ability to concentrate and learn new things. During sleep is when we consolidate memories and where we learn. It clears metabolic waste from our body. It helps us regulate mood, regulate stress. It supports our ability to maintain attention, and it's important for our reaction time even. So chronic poor sleep is linked to faster cognitive decline, higher risk of dementia, higher risk of stroke, worsening mood, worsening mental health, even worsening immune function, so your ability to fight off infections. So it's very important. So when I talk about sleep, what do I mean? So you should aim for about 7 to 9 hours each night. Keeping a regular sleep schedule, that usually means going to bed around the same time every day and waking up at the same time, approximately. Practicing good sleep hygiene. I don't know if you've heard that term before, but what that means is doing things that allow you to fall asleep and stay asleep. So limiting caffeine towards the end of the day, limiting alcohol at the end of the day, not eating large meals at the end of the day, and avoiding bright lights. A lot of people go to bed with their cell phones or the TV on. I'm guilty of that. It is, it's hard, but it does impair your ability to fall asleep and get a good night's sleep. So another very important thing is to get help for issues like insomnia, right? Some people do need medicine because these sleep hygiene doesn't quite cut it. And other people have something called sleep apnea. And I'll take a pause to talk a little bit about that. So sleep apnea is fairly common. It refers to a condition in which there are short pauses in your breathing while you're sleeping. It means that you're constantly waking up, even if you don't realize it. And so you're getting poor sleep and there's not enough oxygen going to your brain. It can lead to high blood pressure, stroke, memory loss, and all of these can affect your brain health. So if you have been diagnosed with sleep apnea or someone's told you that they're concerned for it, it is very important that you do seek medical attention for it. So I am going to pass it on to Kajal, who will be talking about some other factors that are important.
Thanks, Fabi. So something you all have probably heard from your doctors is to exercise. And we always are like, oh, it's just exercise. I can't do it today. I walked a little. But it's very important for your brain to improve that blood flow that goes when you have your heart rate up. And aim to work out at least 150 minutes of active movement per week. So that doesn't mean just like walking around from your bedroom to your kitchen, but actually making an effort to go for a walk or something like that. It doesn't have to be a strenuous exercise. It can be a light walk, moderate walk. You can go gardening. You can do strength training. All of those things count for it. And the goal is to do 150 minutes per week, however you want to divide that. The primary goal that we recommend is that you stay active. Sometimes we have, joint pain and we don't, like the weather is really crappy outside, and so it's hard to go outside for a walk and things like that. So the primary thing you should focus on is stay active. Get up, go around the house. Don't stay seated for most of the time. And the more you try to move yourself, the better your blood flow will be to your body. Every time you move your arms and legs, blood is getting pumped back into your heart and goes up into your brain. And that is very important. It keeps all of those vessels open and it keeps the connection going. Because of this blood flow, it helps support your memory. It helps support the functioning of your brain. Our blood contains the oxygen, which is the food for our brain. So the more we move, the brain gets more food and it stays healthy and happy. So, everyone has probably heard it from one doctor or a heart doctor that like exercise is good for you, but what's good for your heart and your body is also good for your brain. Okay, so it's very important that we stay active. If you have not been active and you want to get active, it's a good idea to start talking to your doctor about how you can get active, if that's something you're struggling with on ideas and things like that. If you want to go from a very sedentary lifestyle to a very active lifestyle, talk to your doctor, because you don't want to go from 0 to 100 right away. You want to take it one step at a time, slowly. Every small step makes way for your long-term goal. So it doesn't have to be 0 to 100. Even a little bit more movement in your day every day will help your brain. All right. The other thing we talk about a lot is substance use and how it relates to brain health. Smoking, drugs, alcohol, all of those things affect your brain chemistry, and that's why doctors usually say, don't do it. I understand that it's if there is an addiction or if there is a habit, it's hard to let go of it, and that's why we have so many resources available to help with this. Some people say, oh, I've been smoking my whole life, I can't stop. Even stopping today will significantly improve the way your brain functions. Even just like stopping it right now today and then going forward, even if you've been smoking for a long time before. Same thing for alcohol, cutting down on how much alcohol you drink, because it affects the way, the chemistry in your brain, and therefore the way it functions. There are free resources available to help with quitting and or reducing how much you are smoking and drinking, and we can help with that. If there is anyone in the audience today that needs help, you can always reach out to us or your primary care doctor or whoever you have available or you feel comfortable talking to. But I can't emphasize this enough, because the benefits of quitting any kind of substance use helps reduce your heart attacks, reduce your stroke, reduce lung disease. It improves better circulation throughout your body, and it overall improves your quality of life, which is very, very important. Let's see if I'm missing anything. All right. The other thing to focus on is mental and emotional health. A lot of times we put these on the back burner and we focus on every aspect of our physical health. We forget the importance of emotional well-being and mental well-being. Feelings of sadness or loss of interest in favored activities that last for a few weeks is not a normal part of aging. It is important that if this is how you feel, or you know that someone around you is feeling this way, you get them help, because once they get treated, it will significantly improve their quality of life, their motivation to participate in day-to-day activities. Some medications can cause depression, so if that is something you're facing, your doctors will look at all the medications you're on and see if that is something that's affecting your emotional and mental well-being. Confusion and attention problems can also be caused by depression, and so if this is something someone is experiencing, it is completely reversible. So if treated, you can go back to full potential of your brain functioning. And treatment can involve therapy. It can also involve medicine. And so it's important that you go to your doctor and talk about this. A positive mood and emotional well-being will protect your brain. If you think that there is some amount of sadness or hopelessness and you are feeling depression, it can reduce your brain's capacity to cope with other lifestyle stressors, and that can further make it harder for you, your attention, your memory. It can cause confusion. So if that is the case, get it addressed right away. And the best thing you can do for someone you think is experiencing this is be there for them. Social support helps reduce stress and boost cognition. The fact that you are all here, I heard that there's a puzzle board outside and that everyone participates in the puzzle board and talks to each other. All of those little interactions help your brain. So it's important to stay connected, talk to people, because that boosts your emotional well-being. And that brings me to the next topic, which is stay connected. People who have meaningful activities in their lives. It could be volunteering, it could be talking to their family, it could be some kind of activity or sport that you do. If it makes you feel happier, it is good for your brain, and it makes your brain healthier. Social activities are linked to reduced risk of dementia and memory problems. Even today, when we have a patient who has existing dementia, what we recommend is stay connected, stay active, read a book, listen to the news, stay engaged in your environment, and those are things that will keep your brain healthy. Because what happens is when you stop using those parts of your brain, your brain forgets to nourish them. And then when it forgets to nourish them, over time, that connection shrinks and shrinks and shrinks. But the more you stimulate it, the more you tell your brain, no, I want you to do problem solving. I want you to stay engaged and be involved in the news or politics or the Sudoku that you like to do. Whatever it is that interests you, your brain will continue to nourish it and keep your brain healthy. Something we recommend is join any social activities or programs in your area or senior center, which is the fact that you're all here today. Those connections that you make with other people in these settings will help your brain. It's very important to have an active social life. And similar to what I said earlier, it's very important you have cognitive engagement, which means that you have engagement that uses your brain for something, whether that is whatever your choice of activity is, knitting or playing tennis or reading the newspaper and staying active. All of those things are important. You know, New York Times has the Wordle. Even doing activities like that, making a schedule like, okay, I'm going to do the Wordle every day. Those kind of things really help your brain. I see that everyone has a puzzle on their table. That is extremely good for your brain. Keeping it active, problem solving, which piece fits in where. All of those things may seem little, but they really help support your brain grow stronger. Challenge your brain regularly so that you can build its reserve, its capacity to cope. So when you do have a stressor, whether that is a lifestyle stressor or infection or illness, your brain's resilience stays. Lifelong learning helps memory, attention, and problem solving. Fabi had said earlier, a healthy brain is still able to learn new language, new memories, new activities. You can still do it. Just because we get older doesn't mean our ability to learn new things goes away. We can't keep saying, oh, I'm old, I can't learn anything anymore. You still can. And the effort you make to learn it helps your brain. Even if you may not learn it fully or 100%, even if you learn it 50%, it really helps your brain thrive. So you can start with like small consistent habits, like 15, 20 minutes a day, and that's okay. Whatever it is to keep your brain engaged. Massage parlors. You can get massages. That's good for your body to relax. You know, that actually is a good point. Stress is another very big factor that affects brain health. So, and you know, it's hard to say, oh, avoid stress, because everyone's life has some kind of stressor, right? But what you can do is find a coping mechanism. How do you help yourself cope with that stress? Whether that is, oh, I like to vent with my friends. I like to go play Scrabble, or whatever it is that helps you de-stress, you should harness that and do it more so you can be better at dealing with stressors or obstacles that come your way. So massage parlors, good way to do that. And then, you know, the next thing we talk about that affects your brain is memory and sensory health, right? Like take what can affect your memory. We had talked about hearing loss earlier. Same with vision loss. Vision loss and hearing loss keeps you, like your vision and your ability to hear keeps you engaged with your environment. So if you're sitting in a table and you hear your neighbor say something, you can get involved in that conversation. But when you don't have appropriate vision or hearing, you start isolating yourself. Your ability to maintain attention starts reducing because you can't hear as well. You're not as engaged. You don't know what's happening in your surroundings. Those kind of things, like I said, then your brain is not making those connections thrive because it's trying less and less hard to pay attention, to stay connected. And so if you have your hearing treated, you can still stay involved. You can still tell your brain, no, I want to keep all these connections, and so I want you to keep putting in your nutrition and your energy to maintain these connections. And that will keep your brain healthy. Otherwise, it'll start to shrink. When your brain doesn't put an effort to maintain these connections, those connections shrink and shrink and shrink. And so we want to try and reduce that shrinking. So untreated hearing loss is actually, the data has proven, leads to a lot faster cognitive decline. So there is some amount of cognitive decline that happens as we age. And so when you have vision problems and hearing loss that is not treated, it can increase exponentially. Vision problems can also lead to falls, which is extremely detrimental at any age. It can lead to fractures, infection, illness, and when you fall and get fractured, then you become sedentary, you can't exercise, you can't sleep well, everything gets messed up, and then your brain is like, I can't cope anymore, and starts to get more rapid cognitive decline. So if, get regular eye exams. If you are someone that struggles with vision and there is not a lot of treatment, you can always have a cane, which I strongly recommend for anyone who struggles with walking. Or if it's something that you are at home and you're fine, that's okay. But every time you go to an unfamiliar environment where you don't know what the terrain is like, always helpful to have a cane so that you can prevent a fall from happening. And that brings me to my next topic, is brain injury. Older adults are at higher risk of falling and other accidents that can cause brain injury. When someone has a new brain injury or past brain injury, it affects how the reserve that I talked about earlier. So say that you have like pneumonia or an infection and you get into the hospital, the fact that you had a brain injury affects that reserve, and your brain's ability to cope with that infection goes down. So you often face with a lot of confusion and rapid cognitive decline. Something called delirium sets in, where in the setting of this active stressor, your brain isn't able to cope with everything, and it just kind of is like, I don't know what's happening, I'm confused, and then you get a lot of confusion, and it takes a long time to recover from that. So what you can do to prevent that is you can exercise to improve balance. Something that I recommend a lot is Tai Chi, which helps your core strength, and it often is very helpful in maintaining your balance. So say that you are about to fall, the Tai Chi and the core strength will help you maintain your posture and prevent a fall. Take fall prevention classes if you are someone who is at risk of falling. Make your home safer, have handlebars and things like that, so when you are walking and you feel dizzy or something like that, you can hold on to something. Make sure you review your medications with your doctors to see there's no reason why that and any of those are causing falls, because sometimes medication side effects can be dizziness, low blood pressure, falls, things like that. And if you are driving, riding bikes or riding a scooter, wear helmets, wear safety belts, whatever it is that'll help your brain stay safe. And I know Fabi said this earlier, but when you have brain injury in the past or present, sleep is extremely important, because when you sleep, your brain heals, and that's what you need the most. You need to allow your brain uninterrupted repair time. So ultimately, preventative care protects your brain and overall health. So make sure, if you feel like everything's fine, it's always okay to talk to your primary care, like, hey, this is everything I'm doing. Is there anything you think I could do better to help my brain? It's always important, if you are worried about something, talk to someone. Even just the worry of like, oh my God, what if something's wrong with me, can affect your brain. So just talk it out with us. Let's get rid of whatever your worries are. If there is something serious, we'll help you treat it, we'll help you cope with it, or whatever it is. But we're here to help, and that is our primary goal. So whatever it is, come reach out to your doctors. If you have other comorbidities, you have high blood pressure, diabetes, cholesterol, those are things all of your doctors usually say, like, make sure they're well controlled. Even from a brain standpoint, those things can affect how your brain functions. As you get older, your blood vessels are a little bit more fragile. So if you have very high blood pressure, it can lead to a brain bleed or a stroke or something like that. And so it's very important we optimize all of these medical conditions that can ultimately affect your brain health. Prevent falls, we talked about this. Remove tripping hazards. Sometimes carpets have those like curved areas. It's always important to flatten them. Just make sure your home is very, very safe, so that if you are sleepy and you go to the bathroom, you don't fall or trip or something like that. And always get any recommended vaccinations from your doctors, because those can help prevent very drastic infections, which can ultimately affect your brain health. And the goal is to make sure that all of these things will help you maintain your independence, so that when you have your independence, you can stay active, keep moving, and you don't have to be dependent. And then when you are active and moving, your blood supply is good, your cognition is good, your emotional well-being is good, and all of those things ultimately help your brain. So what can you do today? So you can pick, we talked about a lot of factors. You can pick one thing to do today that may help your brain, and you can think small. You can do small steps. Take 10-minute walks a few times a week and see how that helps. You do that for a couple weeks, then you go up to 20-minute walks and see how it really helps. Add 1 serving of vegetable each day, and if you feel like you can do it, you can increase your vegetable portions. Similarly, if you feel like you're someone who doesn't like to go to the doctors, try making 1 appointment, sticking to it. and get your physical exam. See what recommendations they do. I think you will feel motivated when you feel yourself accomplishing one small task, and then you can say, oh, look, I can do that, so I can do this as well. And you can help build on the foundation that you're making for yourself. Get support from family, friends, and community groups. If you feel like, you are not alone in any of these things. There is a vast population of people who is probably experiencing the same thing you are or your friends are. And so you're not alone. You always have support. If you are having a hard time finding support, again, we're here for you. And if there is, we have a lot of resources that can help you. This community center is a phenomenal way to get support and resources. But if you want anything else, you can always reach out to your doctors. Does that make sense? Does anybody have any questions? I went over a lot. Yes. I think it is.
It's working out.
Hi, thank you. What about those vitamin supplements they advertise on TV? Is there anything to that?
There are a lot of vitamin supplements out there. Some of them are really good for you, some of them not so much. If there is one particular vitamin supplement you're thinking about, it might be beneficial for you to talk to your doctor. Generally speaking, if it is a multivitamin that your doctor recommended, it's good to take. It's not going to harm you. But I would still recommend you talk to your doctor before starting any new over-the-counter medications, just in case you have other comorbidities that might get affected by them.
What about the ones they advertise for memory and stuff? The memory supplements.
Right. So even for those, some of them are good and some of them are not so good, right? And so it's important when you go to your doctor, they'll look at the ingredient list. And if it's, for example, if it's like, oh, it's a vitamin B12 supplement, that's fine. But if it's a vitamin B12 and like all these other chemicals that might not be good for you, then we'd be like, okay, this might not be a very good idea for you. So there are some memory supplements that are great, but some that I don't recommend. And it's usually based on the ingredient list.
What do you recommend? What do you recommend?
You can make an appointment with me and find out.
B12.
But generally, vitamin B12 is great. So if you are just taking one vitamin and it's vitamin B12, that's really good for your brain health and nerves.
Okay, so you mentioned vitamin B12.
Mm-hmm.
Are we talking plain vitamin B12 or vitamin B12 complex that also helps with stress?
So everyone has different indications for different medications, and that's why I can't make any like blanket statements saying that, oh, this is good for everyone. So there are scenarios where some people need B complex. There are scenarios where some people only need vitamin B12. And that's why I know it sounds like I'm giving you a very like a vague answer, but I really recommend you talk to your doctor, because based on your specific combination of medical conditions, we can then recommend what is like good for you. Hi. Good question. So Alzheimer's is usually something that is very gradual. It doesn't happen rapidly. If you notice something that's happening over a few weeks or months, that's not Alzheimer's, and I would recommend you get immediate help. But it happens very gradually. It starts by forgetting like little things that then add up to not being able to use the remotes or not being able to use the phone, things that you used to be able to do very well before. And then gradually that further progresses, but it can happen over the span of years. So the early indicators would just be forgetting things here and there. Small things like, oh, I left the keys. I don't know where my keys are. Or like some people come to me with their initial complaints being, oh, my mom left the pot on the stove and forgot that she left the pot on the stove. Things like that. Does that help answer your question? Yeah. Usually not like a specific test. Any kind of dementia, there's no real like gold standard to say, oh, you have this dementia versus this dementia. If you do have concerns about your memory, when you go to your doctor, they'll do like a little quiz. It's called a MOCA or a memory test. And based on that, they will say, okay, you have weakness in this domain and this domain, and we'll tell you, okay, this is consistent with this, or this is consistent with the other thing. And then we'll give you resources on how to help your brain. As a neurologist, I will say, some people can function on less sleep, but only for so long. At some point, it catches up, and you need a good amount of sleep at night to help your brain function. Because when you are sleeping, without any interruptions, your brain has time to heal and repair all the things that have happened throughout the day. Because if it's working 24/7, then there's no repair time. So it's very important you give it a good amount of time to repair. I think either of those are not good scenarios. I think that you should try to optimize your amount of sleep with the amount of activities you do during the day. So you want to try and get 7 to 9 hours of sleep every night, and you want to stay active in the times that you are awake.
Excuse me.
Yes.
Earlier you talked about making appointments and sticking with them. I had a TBI about 7 or 8 years ago. In the nursing homes and the group homes, I was avoiding going to the appointments for whatever reasons, whether I didn't want people driving me or I was angry or whatever the case was. Now I'm finally living on my own and feel comfortable going to see a neurosurgeon. And it's so hard to get an appointment, though. I made an appointment last week, and it's 10 months away. So now I'm like, you say, talk to someone about it. It's like,
Yeah.
okay, well, I guess I'll talk to them in about 10 months. So I just wanted to mention that
Yeah.
the help is there, but it's not always there.
I fully understand. There's definitely a very long wait and a very drastic shortage of the specialists that need to be there. But that's why your first point of contact should be your primary care, because they can actually help with a lot of the basics, and while you wait for your specialist appointment, whether that is for neurology or any other specialty, because a lot of the specialists have very long wait times. So it's helpful you can start at least with someone who knows some of the basics, and then you can follow up with your specialist when the appointment comes.
I wanted to ask people having sleep issues, what are your thoughts on melatonin?
Melatonin is great. I usually recommend that if your doctor has prescribed melatonin or you are someone who takes melatonin, don't take it right when you're sleeping. Take it a couple hours before you sleep, because it needs some time to get effective. So if your plan is, okay, I want to go to bed at 9 p.m., then you want to try taking it like 7 p.m. so that you can get sleepy over time, because it's a natural chemical that your body releases on its own, so it needs some time to work. Then you can take it a little bit earlier in the night, or you can talk to your doctor about the dosage, because it might not be the right dosage for you. What was that? You could eat it with your dinner time.
I had a brain injury, a fractured skull, rather. A fractured skull when I was 8. Does that have anything to do with, right now I'm going to be 62. Is there anything I could do, did the brain injury, is that healed enough, or am I still in trouble?
So that's a very good question. I'm really sorry that you had that. I don't know the specifics, but if there was damage to your brain at the time, then like I had mentioned earlier, any kind of brain injury in the past or in the future will affect you and your ability to cope. And so all of these things that we talked about, exercise, sleep, routine, those are very important for you, because that'll help your brain maintain its reserve. Say that you have an illness or you are admitted to the hospital for some reason, then that reserve is what's going to be challenged. And so building that reserve is very important. Yeah. Right. And just to repeat what Dr. Deverona said, no, that's okay. Just to repeat what she said is if you've had an injury in the past and it's been many years now, that injury specifically isn't going to progress, but it can affect how your brain copes. But that particular injury, whatever happened at that time, that is the end of it. It shouldn't progress. What was that? Oh my God, I'm so sorry to hear that.
Yes, I had a stroke a while back, and my left side still numb, tingly, and is that going to, I notice it in the morning real early. Is that going to continue on?
With stroke symptoms, it's kind of like a brain injury, right? Your brain was injured in that specific area, and after going through physical therapy and getting all the treatments, if you still have residual symptoms, it might be something that might stay for a long time. Every human being is different. So for some people, after a stroke, their symptoms go away over time. For some people, they stay. And the best thing you can do now is learn how to manage it. Like, how do you live with it? If that is something that's happened many, many years ago and you still have it. If it's bothering you, you should talk to your neurologist and see what other options there are for you. Of course.
You mentioned stress. Now, we all experience stress. What would you recommend to help us get through the stress, to channel? I mean, I have my own techniques, but I want to hear other techniques. So when you're stressed and you're fuming, what can you do to begin to relieve it, to take the stressor off your brain?
So everyone, like you said, you have your own ways. Everyone has something different that helps them cope with the stress. Some people like to meditate. Some people like to go for a walk. You can't avoid some stressors in your life. They're just going to come and go. There are going to be waves. There are going to be high stress days and low stress days. How you cope with them really matters. And I can't say like, oh, you should try this, but I can give you options. I can say, try journaling. A lot of people are able to vent into their journal and it helps calm them down. Try meditating. It helps clear your mind. Try gardening. A lot of people like gardening. It's an activity that clears their head. Some people like exercising when they're very stressed because that clears their head. Whatever it is that helps you cope with that stressor, I recommend that you do it. Yes. I know that's, again, everyone deals with it differently. For me, for example, if I'm in a position where I'm really, really upset, for me, it helps to just take a step back, take a deep breath, and start over from a very low point. Start over with a very quiet mind, okay, exactly. So this might work for me, but it might not work for Dr. Deverona. Maybe for her, she just has to go for a walk or something like that, right? The point I'm trying to make is everyone is very different. If you are someone who struggles with this and don't know how to handle it, I very strongly recommend that you see a therapist or a counselor, because they actually are skilled and trained in ways that can help you figure out these techniques. That is what their training is in. There is some people have this stigma that oh, I don't want to go see a therapist. What are they going to help me with? But really, what is the harm, right? If you go talk to someone and they help you, great. If they don't help you, okay, well, I tried it. It didn't help me. I'm going to try something else. There is really no harm in just trying and seeing if a therapist helps you, because their entire training is based on this. And they can really help you find ways that can help you feel better. Because we talked about this, emotional and mental well-being is very vital to your brain health.
And one last one is, any indication that anesthesiology or PET scans has any effect at all on the brain?
Everything at the end of the day does affect your brain. Say that you've had a lot of anesthesia over time, it can affect your brain. I can't make a blanket statement saying this affects your brain and this doesn't. Everything does, but in moderation. If a PET scan is something you absolutely need for another medical condition, then it is something you need. and you have to get it. We have to weigh the hypothetical risk of a PET scan with a very active risk of the active medical condition they're working you up for. So if you need anesthesia, if you need a PET scan, and you're worried about its effects on your brain, it's helpful to talk to your doctor to see like what the risks and benefits are. I can't say something doesn't affect your brain. You know, the air we breathe affects our brain, everything affects our brain, but how much and how important it is for you to prioritize those tests is dependent on what the medical condition it is for. Yes.
Can you please comment on restless leg syndrome? Is that neurological or what?
Yeah. It is neurological. Restless leg syndrome is this urge when you are sleeping at night that you have to keep moving it. Many things can cause it. Sometimes anemia can cause it. Sometimes it's just something that happens as we get older. There are medications for it. There are non-medical devices for it that can help as well. A lot of my patients have found relief with medications and non-medical devices as well. So if that is something you're struggling with and aren't able to treat, I do recommend you speak to a neurologist or a primary care doctor because there are a lot of options out there.
Hi, I just had a question on Benadryl and the effect of taking that long term on your memory. I read that Benadryl, taking it like regularly every day could affect your memory, and I'm not sure if I know that's accurate.
I'm glad you asked that question then. So taking Benadryl, if you think about it, what is it? It's an antihistamine. It can affect your brain and your memory, right? Taking it every day, unless you're taking it for an actual medical condition that is recommended by your doctor, for something very tangible, then you just have to take it. But if you are taking it to help you sleep, I think there are better options out there that are safer for helping you sleep without causing the side effects of what an antihistamine every day will cause. That's all I can say for now, right? Like, I think it's just dependent on your specific situation and medical condition. For anyone, antihistamines every single day, like a large dose, isn't ideal. But if you need it for a medical condition, that is a risks and benefits discussion you have with your doctor.
Well, you talk about sleeping, but I understand a lot of people benefit by taking short naps periodically during the day. Now, would that be something that would be helpful?
So we talked about sleeping, which is important. You want long, uninterrupted hours of sleep so you can help your brain heal. Some people wake up in the morning and they feel very unrested. Like they feel like their sleep wasn't restful, they feel very tired, and then that makes them want to take multiple naps during the day. While taking naps during the day isn't bad, but if the naps are preventing you from having a full night's sleep, then it's not ideal. If you feel unrestful, like not well rested in the morning, then maybe the quality of your sleep is not great. And that's something Dr. Deverono talked about, right? We talked about sleep apnea, where you are sleeping. Usually you don't know that you're having these micro awakenings where you wake up for a very brief second. It's so short that your brain doesn't register that you're waking up. And so if you're having these micro awakenings, which you wouldn't know you're having, then you have this like not fully restful sleep and you feel very tired in the morning. That means that your brain isn't fully having time to repair itself. It's staying awake even at night when it should be sleeping. So you should get that addressed. But naps aren't bad during the day. It's just that we want to make sure that you have a full night's sleep at night and you wake up rested. Yes?
Can I be assured of recovering from normal pressure hydrocephalus?
Normal pressure hydrocephalus, there are treatments available for it. I can't give you a guarantee that, your specific situation is 100% treatable. I don't know enough about your specific case. There are ways to treat it, but there are also complications and chronic cases, and there's a lot of other things that happen. For someone who has normal pressure hydrocephalus and you are worried about it, I would talk to your neurosurgeon or neurologist to be able to comment more specifically about your case and your scenario.
Now, someone mentioned naps. I've been taking a nap since I was 4 years old. Okay? Right
Perfect.
after kindergarten. So I find that when I do a lot of brain work, 7 hours into the day, 7 hours into the day, 7.5, or maybe 6, depending on what I'm doing, my brain needs a nap. You know how long? 7 to 10 minutes.
Okay.
I've read research that says that it's not a bad thing because it continues to help you maintain youth, and it maintains your brain healthy. Is that true?
It is true. And like I said earlier, you can take naps during the day. My goal is, this is something, like you said, it's part of your routine, right? Like, you've been doing it since you were young. Your brain is accustomed to it. You are still sleeping at night, so your naps are not a problem and they're good for you. But say that you were sleeping every afternoon for 4 hours, and then you weren't able to sleep at night, and you were waking up too early, or you couldn't go to bed until 2 or 3 a.m. In that situation, I would say that maybe consider skipping a nap so you can make your brain more tired, so you can go to sleep on time.
You have another question?
We have a question right here, sorry. Oh, okay. Just repeat it. Yeah, what was your question? Right. So oftentimes we see that as we get older, our ability to maintain sleep is affected. So you still go to bed on time, but you wake up very early in the morning. Right. And so if you're... Yeah. Yeah. So in that case, the question is, how do we help her maintain her sleep? And I would honestly talk to a doctor about it. There are options, to help you have sleep maintenance. I can't make any official recommendations right now without knowing her, but I do recommend that you see a doctor for it because they can certainly help. Yeah.
Yeah, you mentioned something about counseling, seeing a therapist. And I did have a lot of depression in my life since my husband passed 4 years ago. And it's been helping. And I see her every week.
I'm very happy that worked for you.
Yeah.
That's amazing.
Yeah, so I figure counseling is one of the things that you can do too to get some of the stress off.
I agree. I 100% agree. And that is just one example of the many that have been helped with counseling, right? So it's not a bad idea to try. There's no stigma associated with it. Any other questions out there? All right. Well, thank you everyone for having us talk about brain health with you. If you have any questions, you can always come up here and talk to us. If you are worried about anything, always make an appointment with your doctor. Talk to them in more detail about your specific situation. But yeah, we're here to help, and we have all the resources, so let us know.
Super program. Let's hear another round of applause. Thank you. Thank you so much.